Well, the fall sports season is well underway, and we know injuries can sometimes be part of the game. In tonight's Health Matters by Holston Medical Group, we meet a local sports medicine doctor who became a patient following a severe knee injury. Dr. Emily Campbell tells us how it's changed her perspective on the recovery process.
My husband and I were training for an endurance event, and we were about 4 months into the 6 months training plan, and I ended up injuring my knee pretty severely.
Severely enough that it required surgery and months of recovery, turning this sports medicine doctor into a patient.
You hear your own words come back to you, which is always a little humbling. You just don't really understand until you have to walk that path.
Following the surgery, Dr. Campbell wasn't able to put any weight on that leg, meaning crutches and help from family and friends. It also meant time off work and not being able to do the things she normally would. It was an entirely different reality.
I really like the word grief, and I think grief cycle is a really important term for something like this that is very dramatic and really rips someone out of their normal day-to-day life.
Dr. Campbell started a journal, tracking her days so she could look back at the progress she had made. She also says she had to take her own advice to be patient.
Nothing beats the clock, and I've tried, many times to try to help athletes and families understand how long something takes to recover, and we try to beat the clock all the time. And time is really the ultimate healer, and once you submit to that, then you almost take the pressure off of trying to beat the clock.
Dr. Campbell calls it silent work.
The dedicated rehab that you do every day that nobody sees and is not broadcast to anyone but yourself is the work that gets you better. And only you know if you've done the work that you need to do.
She now shares her story with her patients, encouraging them to begin journaling, work through the grief process, maintain good nutrition, and surround yourself with supportive friends and family. She also says everyone should train for life, keeping their bodies strong and healthy.
Those things were crucial in making sure that I didn't have other injuries that were, occurring because I was trying to compensate for my initial injury. So training for life is the approach to allow anything like this to happen and to try to get through it as smoothly as possible.
Dr. Campbell is now walking on her own and back to work with a new perspective. She is still healing. She's not yet ready to hike and bike, but she says she truly understands now both the physical and the emotional side of injuries. To read more about her story, please visit the Health Matters blog at holstonmedicalgroup.com.